I'm excited to share with you our progress on the UmbreLAA, a size-adjustable left atrial appendage occlusion device to prevent stroke in patients with atrial fibrillation. AFib is the most common cardiac arrhythmia and is estimated to affect 37 million people worldwide. AFib increases the risk of clot formation in the heart. These clots can dislodge and travel to the brain, causing a stroke. People with AFib have a five-fold risk of having a stroke, and 1 in 3 patients with AFib are estimated to have a stroke in their lifetime. 90% of clots in patients with AFib originate in the left atrial appendage, or LAA. As such, devices that mechanically occlude the LAA have been developed to reduce the risk of stroke. However, current devices do not cover the wide range of interpatient heterogeneity in LAA size and shape. The diameter of the LAA opening, or ostium, ranges between 5 to 40 millimeters, while current devices only cover dimensions between 11 to 31.5 millimeters. Multiple devices of different sizes are needed to cover this range, introducing the risk of potentially choosing an inappropriately sized device. Certain geometries, like those with multiple lobes, cannot be sufficiently occluded with devices, and device anatomy mismatch increases the risk of complications, including peri-device leakage and device thrombosis. To reduce device anatomy mismatch, and thereby also increase the number of people that can benefit from mechanical occlusion, we have designed a device that both supports a larger range of anatomical variation and whose width can be changed in situ to match the specific anatomy of the patient. The UmbreLAA. Unlike other devices, the base diameter of the UmbreLAA can be changed during insertion by a trained operator, thereby allowing large ranges of LAA diameters to be accommodated by a single device size. The UmbreLAA consists of 2 parts, the expandable plug and an accompanying pacifier module. The plug anchors to the wall of the LAA, and its width can be adjusted in situ. The pacifier sits just outside the ostium and provides a second seal against clots. The frame of the UmbreLAA consists of a flexible silicone with elastic joints that allow the device to collapse within a catheter for percutaneous delivery. We took inspiration from an UmbreLAA to design the expanding mechanism. By rotating the distal nut, the length of the device is changed, thereby contracting or expanding the prongs. By this expansion, the UmbreLAA can cover a larger size range in 2 sizes compared to the Boston Scientific Watchman Flex device, which requires 5 device sizes to cover a smaller size range. We manufactured prototypes to test the performance of the UmbreLAA. Here we show the prototype's ability to expand. You can envision how an operator may turn the screw to expand the plug until it reaches the appropriate size. The ability to adjust the size of the device during surgery gives the operator greater flexibility to achieve a secure fit within the patient's LAA. We tested the prototype's ability to conform in different ostium shapes and identified peri-device gaps, represented here in black. We tested its ability to seal against leaks by measuring the amount of material that can pass through these gaps. We quantified stability by measuring the amount of force required to pull the device out of the ostium models. During these tests, we contracted the LAA molds by 25% at a rate of 60 contractions per minute to simulate a beating heart. We found that the UmbreLAA was able to conform to fill oval ostiums because each prong has the flexibility to compress to a different length. Qualitatively, we saw smaller peri-device gaps compared to the Watchman Flex. We found that in round ostium models, there is no significant leakage in either the UmbreLAA or the Watchman. In extremely ovular ostium, there is much more peri-device leakage, with the Watchman devices leaking approximately 79% of the introduced material, and the UmbreLAA leaking approximately 66%. By adding the pacifier module to the UmbreLAA, we were able to reduce this leakage almost completely. Stability tests indicated that the force required to pull the UmbreLAA out of the molds far exceeded the force required to pull Watchman devices out of the molds. These results indicate that we can optimize the UmbreLAA's anchors to make them less traumatic while still maintaining sufficient device stability. Overall, these tests indicate that the UmbreLAA can effectively seal ostiums of different shapes and sizes, especially with the inclusion of the pacifier module. In the future, we plan to build prototypes using high-precision silicone machining, conduct fatigue life tests, and work with clinicians to develop deployment processes for the device. With that, I'd like to thank the great team of engineers that worked on this project, and I look forward to speaking more about the UmbreLAA with all of you in person.